Hello, I'm Ryan Grack, one of the co-founders of Digital Health Malta, and together with Frontiers Health, I would like to welcome you to the Malta Local Hub, hosted by Digital Health Malta and supported by the MatTech Summit. Obviously, COVID-19 has taken the world by storm, and whereas most industries were suppressed, COVID-19 has certainly accelerated growth in the digital health sphere. We have seen record-breaking investments in the US with similar trends following in Europe. And naturally, most news reports tend to focus on the bigger countries like the US, Australia, UK, or France. However, today we would like to shed a spotlight on how Malta, a small country in the middle of the Mediterranean, has handled COVID, with the regional director, Hans Klug, saying that Malta is an example to follow. This could not have happened, I think, without the public and private sector synergies. And joining me today are Dr. Stefan Buttigieg, specialist in public health and forming part of the government's COVID-19 response team, who together with his colleagues manages the technological infrastructure behind Malta's successful response. Ms. Diana Farrugia, CEO of Tech.MT, whose work has been pivotal in the digital innovation sector within Malta over the past couple of months. And finally, Dr. Dirnat Tart, co-founder of Tabib.MT, one of the leading telehealth platforms in Malta, and also on the front line of the COVID-19 fight, as he currently is a surgical trainee as well in Malta's acute hospital. Stefan, if I can start the conversation with you, can you talk us through how a team of doctors along with IT professionals have leveraged technology in their fight against COVID-19?
Okay, so the COVID-19 public health response team is quite big. We're talking in the region of 300 people working actively to stop the pandemic. But one of the teams is known as the data management and IT team, and one of their main roles is basically to create the operational data structures and information systems behind the whole response. And if I have to start off with something, our team basically was fully responsible of deploying a number of information systems, and not just deploying them once, but also seeking continually evolving solutions to build on what has been done and to even improve further. For example, first we started off with an outbreak management system, and then we evolved further, and we started introducing flows and connections between different systems. And then we even looked towards, for example, COVID Alert Malta, which is our official contact tracing app. So step by step, and I would say in quite a fast timeline, we're talking at about 6 months here, we evolved continuously, and we operated and we talked to other teams, we saw their needs, and continuously evolved. Also, apart from this, we have been involved on a daily basis with giving the results to thousands and thousands of people. So this has really evolved, and now, sooner rather than later, we're actually going to be launching something quite soon to further continuously improve our systems. And this is a result of this continuously evolving situation that we've developed over the past months.
So I would say adaptation has been key in something like this. So now moving a bit on to the private sector, perhaps Dylan, what is Tabib.MT and maybe how has it helped the COVID-19 response?
All right, first of all, thank you for having me here today. Tabib.MT is simply a way of how we can, in Malta, currently connect with patients with their local healthcare practitioners. Before COVID-19, in Malta, telemedicine was formally recognized as quite a scarce service. Patients used to connect with their doctors or any healthcare practitioners by simply, for example, messaging them on Facebook or WhatsApp in a non-formal way. What Tabib set out to provide is a formalized, safe and secure way of how to connect patients with their healthcare practitioners. We started off by having just doctors, but then especially with the increased demand, with the increase of success of how we were connecting patients with their doctors, we've extended this service to most healthcare practitioners. Since April, since we founded it, we've seen quite an increase, a drastic increase in the uptake of telemedicine services, and one has to give note, especially since Malta is a small island, we don't have the geographical boundaries that, for example, countries might have. But technology is still playing an important role of connecting patients with their healthcare practitioners.
That's very interesting. Especially the idea that you highlighted that you don't really need geographical boundaries to really
Exactly.
benefits of
Yes, exactly.
telemedicine.
Because this was one of our challenges. Actually, in fact, we thought, but in Malta, like you're 5 minutes or 10 minutes away from seeking a GP or any healthcare practitioner. But people, especially because they started recognizing the risk, for example, of the increased risk of contacting COVID, it's sort of pushed them to see telemedicine as a useful way. We're not speaking here about, for example, beating the face-to-face clinics. We're here to supplement the existing local healthcare pathways, both publicly and private. I mean, Malta does have its free healthcare system. We have one of the best in the world healthcare systems. I mean, even how we're managing, how we initially managed COVID and are now trying to fight the increased number of waves. Our existing healthcare systems, they're there and they've already, they're functioning to the best they can. But such private telemedicine services and other digital health tools, which we, Tabib.MT, have in mind to as well in the future launch, they can work synergistically with all existing healthcare pathways.
Good to know. Good. Dana, if I may turn a bit to you. So we've kind of heard now from both public and private sector here, and I think that we kind of can both agree that both have kind of helped and complemented each other in the fight of COVID. What I'd like to delve a bit into is, what do you think of public-private partnerships in science, technology, and innovation?
In my opinion, I think it's a golden opportunity when you have the private sector and the public sector working in line and synergizing resources to arrive to the same result. With regards to our islands, to Malta, we are seeing this happening more and more. In this particular case, we have doctors who also have a flair for technology, who are marrying both worlds together. And we have a solution like Tabib.MT, which will solve a lot of first-line problems or bureaucracy in processes, or maybe reduce waiting times and optimize service even from the doctor's perspective, because doctors constantly meet patients who are sick with various conditions. So first line, they can at least convert to a digital solution, and it's a safe solution because it's a solution which is integrated, as Stefan rightly mentioned before, the integration between systems that allows for a virtual connection which is happening on a safe platform.
I think that's extremely important. What you hinted at is, that safety remains the priority in all of these solutions. And I think one striking thing about Malta is that despite our size, I feel that our disease demographic is quite similar to most developed nations, which possibly makes it an ideal test base for digital health products. Dana, you've managed to push forward the digital agenda within Malta impeccably, and we're starting to see a number of successes rising in Malta from the different industries. What makes Malta the ideal destination to attract foreign direct investment within the digital health sphere?
I think, Ryan, to understand my answer in this sphere, one has to first mention which spheres of technology and medicine we are competing in as an island. We have managed to attract investment related to precision medicine, particularly robotics. We already have our national hospital using such solutions. We're trying to attract even more research and development on that front, more avant-garde equipment, which can be preventive equipment even for health conditions. We're also competing for solutions related to converged systems, so that we can have an option, an array of solutions available on our island, and also solutions being developed on our island, learning from what we are doing. As an island as well, we have a very sturdy infrastructure when it comes to digital infrastructure, so we can deliver a service over a reliable infrastructure, and the medical industry needs a reliable infrastructure to be able to operate, because we are talking here about people's lives, and that is major. It's extremely important. And above all these teams, we also have the opportunity to extract a lot of data from what is happening in our medical industry and process it and develop applications related to that data which can make our lives better. So here we have flares of artificial intelligence, Internet of Things, big data processing, and this is all attracting technology, the best solutions in technology to assist the medical sector, and vice versa. The medical sector in Malta is providing vital information. I believe even the WHO organization recognizes that we are one of the countries that collects a lot of valuable data. In the future, data will be the next asset. Everybody knows that we are moving towards that direction, and we are already thinking about that. And the data is available, so when companies come here to maybe analyze trends or produce new processes or invent new software related to medicines, they use our data as prototypes wherever possible, obviously, with all the GDPR regulations, etc.
Thank you. So, Stefan, you already hinted to this a bit before, the COVID Alert Malta. Yeah. So it's another initiative, obviously, by the COVID response team, and I think you've developed this along with the Malta Information Technology Agency, is that correct?
Yes, in fact, we are lucky, not only the Malta Information Technology Agency, but also the Malta Digital Innovation Authority, which has invested a significant amount of money actually into the information security audit behind it. In fact, I think the innovation behind COVID Alert Malta is how focused we were on privacy and security. I think that's basically one of the biggest innovations there, Ryan.
So, further to this, I think my understanding has been that Malta has seen quite an extremely good uptake in terms of people actually downloading this app and making use of it. So maybe can you elaborate a bit more on why you think this is so, particularly when in other countries such as the UK, such as France, we've seen that maybe there hasn't been this a similar kind of interaction with these apps?
Yeah, I look actually towards other countries who had a higher uptake than us. I look towards Finland and Ireland, but actually we're quite comparable to Italy at 15% approximately of the population. So we really are doing quite well. I think we're definitely in the top 10 around Europe. But I think the reason why it was so successful in Malta is that because it had high level backing. That means that when you take the time and you give enough time for the processes to actually work through, and you actually reach out to all the relevant stakeholders, you have a higher and higher chance for you to be successful, especially with an app like this, which is needed to not just have only, for example, 1% of the population, but it needs a high percentage of the population for it to be more successful. With every device that downloads the app, we have one more chance to stop this spread of the COVID-19 pandemic in Malta.
And if I can add, Stefan, I think, sorry, Ryan, I think
go ahead.
This is one of the advantages of Malta. It's a close-knit country, sort of like a big city, if you can compare it, you can say so. So for everyone is so close-knit, even they follow for the local government. For example, the health minister comes backing up, for example, the COVID alert application. When, for example, the public health launched its own telemedicine services, they all in turn help to continue promoting the public services as well as the private entities, like Tech.MT and other initiatives, and then spurs on competition, for example, within the local digital health industry, to continue innovating, continue competing with each other, and hence reach out to new ambitions.
Perhaps, like Dana said earlier, had we not have the correct infrastructure for this to happen, I'm pretty sure that would still be lost, unfortunately. Stefan, sorry, I'm badgering you at the moment.
No worries.
I guess another interesting question that I might have is, I know that you're kind of you're not directly involved with traditional track and trace methods, but can you maybe give us a reflection of how that compares to the app? Does that make your life easier at all?
Okay, so this is a very interesting, and actually there's a lot of scientific basis behind it as well. As things stand right now, we're doing such a big effort to make sure that the privacy is not revealed. That actually, right now, if you had to compare them directly, we do not have all the information available for us to make a very scientific and evidence-based answer to your question. But what I can tell you is this, that we are offering another solution for patients, especially for COVID positive patients, to reach out to their contacts in a private and secure way. So giving them that. So let's say there might be some delays in contact tracing, for example, or there might be some, a bit of a lag because of the number of cases. And this is natural, it happens in all countries around Europe. What happens basically, you have this solution, which is there available for them. We can give it to them, we can give them the code, and they'll be able to reach their contacts at a faster speed. So even like if you had to consider what is faster, if it is a telephone call, where you have to call, for example, 50 people one day, or an app which alerts instantly once that person uploads the code, I think I would go for the one where there is the instant notification, so to say.
And were you faced with any skepticism in terms of privacy? I know that you've said it has been the centerfold thing, but we all know that all around the world there's been some backlash, perhaps.
Yeah. In fact, for example, if you see throughout the pandemic, there was a kind of an evolution from the centralized model towards the decentralized model. And first there were some countries that actually adopted the centralized model, but inevitably they switched steadily and slowly actually to the decentralized model. And even in Malta, yes, we had challenges, we had questions, but how did we deal with the questions? We did by dealing and communicating directly with the Data Protection Commissioner. That made the whole difference. Involving the Data Protection Commissioner from the very beginning, from the inception of this project, even if it took long, but involving him from the very beginning helped us get the success we needed as well. Also, one thing which was in our favor as well is that the project is based on an open source project. So even the open source project itself, which was being used by more than one country, also had in itself a data protection impact assessment. So we had a basis, we had something, and I think the future for Malta is to collaborate more with open source projects and to even contribute, to be one of the major contributors behind this. And even, for example, we had another solution called COVID-19 Check, where actually we based on another open source project from Estonia. Very, very interesting. We adapted it, we customized it, but it was easy, it was deployable, and we reached out a bigger audience at a shorter period of time. That took nearly a month and a half. And open source really is the key, and open source and close collaboration with all stakeholders is really key for us, for our digital health, even to move at a faster pace than we already are.
No, I agree, actually, sorry, Ryan, regarding the open source, but unfortunately, I think the thing is that those who understand what an open source is are the same ones who trust this kind of technology.
Okay.
So I do perfectly agree that, for example, even for digital health to flourish, especially like Dana was saying, when it comes to healthcare, people need to trust where the source is, and they're not going to just trust any companies to deal with their medical data, with their health conditions. Those are the same kind of people. We as both coming from the private sector, I do work in the public sector as well, and though we need to collaborate together to further to continue educating these people, because as I said before, those who understand what an open source is, what the application is made of, those who understand where their data is going, are those who do acknowledge this kind of technology. So we need to put more efforts to educating the rest of the population, not necessarily what an open source is, but what is going to be what is happening to their data.
Yeah.
And speaking in terms of education, I know that Tech.MT has actually been doing an excellent job in that sense. I mean, the public education in terms of technology. I mean, I think maybe then I can tell us a bit more, but I think that in general, the population is not, I mean, I don't want to say not educated, but they don't really understand where, for example, their data actually goes, or if they upload that video on Facebook, what happens to that video, perhaps.
Yes, Ryan, I think that as we can see, we have doctors who are telling us, listen, technology will never replace ultimately the service that a physical doctor will give you. However, they see the positive side of having an assistive tool, which is technology, helping them to carry out their jobs better, especially in times where we are hit with a pandemic like this. COVID was a catalyst to shift forward digitization. And I think now what needs to happen, change is already happening because it's happening from top to bottom. The government is already adopting this approach, the private sector is already moving there. Now we need to focus on changing the culture. And we change the culture through education, through awareness, and also through use of these applications that are being obviously put forward to society. And the moment that someone uses that application and it's useful and successful and safe, because I stress again, in health, safety plays a major role, then people start believing in these services and we start transitioning our society slowly towards a more digitized country.
I think that's, oh, sorry.
And rightly said, actually. I mean, from speaking from Tech.MT point of view, I think most of our time, energy, and even funds, they're being invested towards not promoting Tech.MT as a service, but promoting the benefits of digital health. I mean, even one of our challenges is, for example, trying to align all the major key stakeholders, be it, for example, insurance companies, be it local public health, trying to align them together to recognize telemedicine or any other digital health tool for what it's matter, but the general public, as soon as they see a general uptake by their local, by the local government, the local key stakeholders, they will then lower down their barriers and start using it. And at the end of the day, for be it Tech.MT as a telemedicine platform, be it any other private digital health tool, we're only here to help elevate pressure off from local existing public healthcare pathways, basically.
Coupled to what Dylan is saying, if we had to take an example, way back, we had seen a change in the process of the distribution of physical medicine, what we know today as the Pharmacy of Your Choice initiative. In the beginning, everyone was still used to going to our national hospital to collect pills, to collect medicines physically, and it was a major catastrophe because this process was automated and shifted to local pharmacies. The moment that people started then experiencing this new process, now they see the benefit of how more convenient it is, how more serious it is. Your data is all captured in your file, you have a history, your pharmacist knows immediately your conditions, they can help you, they can direct you swiftly, whether it is a new medicine that you might need, that might contradict with current medicines that you are taking, or else to distribute additional medication more fast, rather than going to the national hospital and explaining what medicines you still take, and you are diagnosed with something else and you need to take something else. And I always bring that example to show people, listen, see in what situation we are today with that process. It has already gone a lot of miles, and we can do a lot more with solutions like Tabib.MT and the COVID app, tracing app, and much more.
I think this example that you just given just highlights exactly what you meant before by culture change, and
yes,
it's hopefully something that we should keep on striving for. Keeping on the theme a bit of skepticism that I brought before with Stefan. Dylan, so Tabib.MT is focused on providing an efficient telemedicine platform, which is pretty much tailor-made for the Maltese Islands. And a question which perhaps takes you a bit more globally, is telemedicine something that we need to embrace? I mean, I've known a couple of people that have been skeptical about telemedicine. So is it just one of these things that just hyped up and fueled further by COVID, or do you think that there is room for telemedicine in the future as well?
I'm obviously going to sound biased, considering I'm one of the co-founders of a local telemedicine startup, but I think even if you look abroad internationally at the reports, at how the investment change trends changed over the past couple of months, even before COVID. I mean, telemedicine came to light in Malta because of COVID, but internationally, UK, USA, telemedicine has been a rising service for the past couple of years. Everyone is embracing it. It's just a matter of when. Now, COVID shifted the whole process, improved the whole process by a number of years, which is some countries, for example, may not be yet prepared to embrace such a shift in service and telemedicine, but most of the developed countries like Malta has, for example, a good broadband network from 4G to 5G. Everyone knows how, probably owns a smartphone, and even better knows how to use one. So all the key things are in place. We just need the correct synergies between all the local key stakeholders to synergize together, to collaborate together, and improve our existing local healthcare pathways.
It's an interesting insight. To close off, I would like to ask all of you now something that maybe is more in line with your day-to-day running. So starting with you, Stefan, public health and technology. Do you think that there is a future there? Will we be seeing more technology in public health in the future?
I think we're just at the beginning. So the future we're looking at, especially when you take in consideration the history that we had, for example, the past couple of months with lockdowns, we are now looking towards a future of precision public health. And that's where we need to go, and that should be our vision. And that can only be with data and technology.
Dana, so what potential does Tech.MT see in digital health?
Well, this is a niche market, as Stefan said. This is just the beginning, so we have a huge opportunity. Even our positioning, our geographical position, makes us in an advantageous, puts us at an advantageous position to reach continents like North Africa and the Emirates, and supply them with services related to health. So the foreign direct investment that we bring here does not stop here, and we are an island which gives further opportunities. Services can be redistributed to other markets, so the potential for growth here is very strong. And also for our local market, we are going to ensure that with regards to health, we continue to develop our potential in terms of technology and health, so that our society at the end of the day is supplied with the best medical health service as is today, and more.
And Dylan, finally with you, maybe a sneak peek into what we may expect from Tabib.MT?
I mean, the future looks very exciting. It looks very exciting for Tabib.MT. It looks very exciting for Malta from a digital health perspective. Our ambition is obviously to consolidate our services locally and seek beyond Malta. I mean, as we were saying before, Malta is the ideal country to use as a test-based population, and then to reciprocate once products, once technology abroad, and even look further. I mean, telemedicine is just the tip of the iceberg when it comes to digital health. I won't say that me personally, even as Tabib.MT, will stop here when it comes to digital health. We'll look to eventually deploy more digital health solutions locally. And apart from us deploying local health, we look also to revolutionize the local digital healthcare sector. I mean, what I would like Tabib.MT to represent is the local emergence, the local company emergence of a digital health company manned by, created by, technology all by Maltese people, be it in collaboration with other foreigners, but at least Tabib.MT would symbolize Malta's emerging digital health sector.
Thanks for that. So I think that the public and private sector should always find ways in which they can harmonize each other, really. And I think that what our panelists have just shown today is evidence that working together enables the development of a healthy ecosystem. Unfortunately, that is all we have time for today. It's been great having you on, and I want to thank you all for being here.